Hello, all. Myself Dr. Satish, Associate Professor in the Department of Genetic Engineering, SRM Institute of Science and Technology, Katangalatun. Here we are going to talk about nanotechnology for cancer diagnosis and treatment. Cancer is uncontrolled growth and spread of abnormal cells in your body. Cancer is the second leading cause of death worldwide. Cancer treatment. The long-standing strategy is to flood the body with substances that are especially toxic to tumor cells. They also are toxic to healthy cells. System-wide damage and the serious side effects are happening because of cancer treatment. The few cancer treatments include chemotherapy, radiation therapy, immunotherapy, and gene therapy. The current cancer treatment has several drawbacks and challenges. It includes high cost, less efficiency, severe adverse effects, and then the drug resistance and tumor relapse. Nanotechnology, the power of small. This is a new and revolutionary technology that will change all that we know before. So a nanometer is 1 billionth of a meter. Our cell size varies. The sperm cells, which are 4 to 6 micrometer, then RBC 6 to 8 micrometer. The largest is human cell ovum is 100 to 120 micrometer. The epithelial cells range from 100 to 20 micrometer in scale. So more surface area of these nanoparticles results in the more atoms to be exposed, and then greater potential for interaction and chemical reaction. There are several applications of nanotechnology in cancer that includes detection and diagnosis, drug delivery, targeted therapy, imaging, biomarker mapping, and then gene delivery. FDA has approved cell search mission for detection of cancer from the blood sample. So cancer circulating tumor cells are cancer cells that are released into the circulation, and then you can detect them using nanoparticles loaded with ion, and then functionalized with antibodies that can efficiently identify these circulating tumor cells. As you can see here, these are cancer cells which are trapped with this magnetic nanoparticle, and then these cells are negative for CD45, which is a blood cell origin. So we should detect only the cancer cells in the circulation, not the immune cells and other blood cells. So DAPI stains the nucleus, so to show that these are cells. For targeting cancer cells specifically, we should know the difference between the normal cells and cancer cells. The folate receptor is being used for actively targeting cancer cells specifically. The folate receptor is a membrane-anchored glycoprotein that binds and transports folic acid, a vitamin essential for DNA biosynthesis. The expression of folate receptors on the surface of cancer cell is significantly higher, up to 34-fold compared to the normal cells. Folate receptor staining in normal colorectal mucosa was weak in 93%, whereas there is strong staining in primary and metastatic colorectal cancer. So folate receptor is overexpressed in gynecological cancer. Other tumor types includes ovarian, breast, lung, and colon cancer. This overexpression creates a great opportunity for folic acid conjugated nanoparticles to preferentially be taken up by the cancer cells. Surgical oncologists, when they open up the patient to remove the tumor out, on the left, this is the image they see. So it will be hard for them to tell where the tumor is, where the inflammation is, which part should be resected out. So thanks to this folate receptor, as it can be exploited for detecting the tumor in patients in real time, so where they can inject the nanoparticle coated with the folate expressing green fluorescence. So when they injected it in the tumor area, so they can clearly see where the tumor is, and then tumor boundaries can be marked efficiently, and then surgical resection can be done efficiently. So now let's talk about nanoparticles for cancer therapy. So ideal nanomedicine for cancer should satisfy several requirements, including the ability to escape from the blood vessel, the possibility to retain in the tumor site, selective cellular uptake of the drug carrier to the cancer cells by utilizing the difference between the normal and cancer cells. So first one is passive targeting of cancer cells. So enhanced permeability and retention. So here the healthy tissue has blood vessels which are healthy too, and then the lymphatic drainage that works fine. Whereas in the tumor tissue, so there is a leaky vasculature because the new blood vessels angiogenesis has happened towards the tumor. So there is a leaky vasculature, and then the lymphatic drainage is clogged too. So if you want to target the cancer cells, you should use a nanoparticle that should enter into this leaky vasculature, and then that should be retained in the tumor for longer term because of the lymphatic drainage blockage. So for that, the nanoparticle should be designed in the optimal size. So now active targeting of cancer cells. This can be done by conjugating the nanoparticle with antibodies specifically bind to the cancer cells, or peptides that can go and reach the cancer cells, or aptamers which are specific for the surface molecules of the cancer cells. Overexpression of EGFR, VEGFR, and integrins, transferrin receptors, and folate receptors in cancer cells were widely exploited for targeting the cancer cells specifically. In this diagram, we are showing the cancer cells overexpressing folate receptor, and then the nanoparticle, when it is functionalized with the folate, they can be efficiently bind to this folate receptor, and then receptor mediated endocytosis results in engulfing or entering of nanoparticle into the cancer cells specifically. Hesperethrin is a bioflavonoid present in citrus fruits. It is shown to have anti-inflammatory, anti-hypertensive, and then anti-atherogenic effects. And then recent papers have shown that it is having anti-proliferative effect on cervical cancer cells. So, however, this molecule is having poor water solubility. So even if the molecule is having poor water solubility, we can use chitosan as a drug carrier. So chitosan is a sugar that is obtained from a hard outer skeleton of crustaceans such as crabs, lobsters, shrimp. It can be used for making medicine. Chitosan is a non-toxic polymer and is easily taken up by the cancer cells or any cells for that matter. Chitosans are recognized as versatile biomaterial because of their non-toxic, low allergenic, and then biocompatibility and biodegradability. So what we can do is that we can make a nanoparticle with the chitosan, and then we can encapsulate it with the drugs that are having poor water solubility, and then we can functionalize the surface with the folate so that it can be taken up by the cancer cell efficiently. This is like a Trojan horse strategy where the soldiers are hidden inside the horse and then they can come out and then attack anytime. The same way, the nanoparticle is loaded with the cancer drugs, and then the folate is like the food. So for the cancer cells that are actively dividing, so they will take up this nanoparticle efficiently, but the drugs get released from inside and then start attacking the cancer cells. So this shows how you can conjugate the chitosan and then folate, and then how you can efficiently encapsulate the drug inside the nanoparticle. So this is preparation of chitosan, folate, aspartame nanoparticle. So this is a cell proliferation assay. As the dose of the compound increases, the survival of the cancer cells decreases. If you could see, the inhibitory concentration of killing more cancer cells is very high. So if you try to do a chitosan folate aspartame nanoparticle, you can see aspartame and chitosan alone has very less effect at the dose that is given. But when you make it chitosan folate aspartame, it is efficiently killing the cancer cells at an even lower concentration. As you can see here, aspartame alone, it killed the cancer cell proliferation, inhibited the cancer cell proliferation, and then chitosan folate aspartame is better than the aspartame alone. So nanoshells for cancer therapy. Nanoshells are minuscule beads coated with gold. Can design these beads to absorb specific wavelength of light. The most useful nanoshell are those that absorb near infrared light, which can easily penetrate several centimeters of the human tissue. So absorption of light by this nanoshell creates an intense heat that is lethal to the cells. So if you can link antibodies to the nanoshell, and then that can recognize the cancer cells specifically, after the nanoshells enter into the cancer cells, so you can use light to produce heat and then kill the cancer cell specifically. So tumor microenvironment is low pH, which is less than 6.8, which is contrary to the surrounding normal tissue, which is around a pH of 7.4, attributed to the glycolysis process, which the cancer cells prefer. So acidic tumor pH responsive nanoparticles can be made so that you can directly target the cancer cells without affecting the normal cells. So cancer stem cells are like a root of the cancer. So these are numerically rare cells within the tumor with the ability to self-renew and give rise to the phenotypically diverse population of cells in the tumor. So this drives the process of tumorigenesis, main reason for the tumor recurrence and metastasis, and dire need for developing therapeutics strategies to target the cancer stem cells. So this is a tumor with the numerically rare cancer stem cells. If you could give the current chemotherapeutic drugs, it will kill the fast dividing cancer cells, but it will not affect the cancer stem cells. So they survive and then they give rise to the whole tumor again. It's called tumor relapse. Whereas if you give a stem cell targeted therapy, it kills the cancer stem cell population, and then if you give the current chemotherapy, it will shrink this tumor and then kill the cancer stem cells, thereby the tumor is completely destroyed. Double cotin-like kinase 1 has been shown to mark the cancer stem cells, and then there are Nature publications suggesting that if you could target the cancer stem cells, you can efficiently inhibit the tumor growth. So DCLK1 could be an effective target to inhibit the cancer stem cells specifically. So there are strategies to design nanoparticle and functionalize it with the antibodies against the DCLK1. In this way, you can selectively target the cancer stem cells. So this is a spheroid assay. Colonospheroid assay is a 3D culture of cancer cells in an ultra low attachment plate with a specific media conditions that is already standardized, which enriches the cancer stem cell population. So if a compound inhibits this growth of spheroids in ultra low attachment plate, they are efficient in inhibiting the cancer stem cells. So in this study, if you could see, the control cells where the cancer cells are growing in ultra low attachment plate, the spheroids are huge. And then when the CFH, chitosan folate aspirin, is treated, the size of the spheroids are decreased. But however, when you use CFH, chitosan folate aspirin, functionalized with DCLK1, effectively inhibited the cancer stem cell population. So this could be a very good cancer stem cell targeted nanoparticle for treating cancer. This slide shows the evolution of nanotechnology, how it is helping the cancer treatment and diagnosis. So synthesis of nanoparticle, and then how to target the nanoparticle efficiently against cancer cells, and then how to load the chemotherapeutic drugs into the nanoparticle so that we can directly target the cancer cells specifically, how to target cancer stem cells specifically. So the field has been evolved, and then there are several clinical trials, and then there is promise for nanotechnology in cancer diagnosis and cancer treatment. Thank you. I hope you understood the importance of nanotechnology in cancer diagnosis and cancer treatment with this video. Thanks.